Hello, my name is Jean Yang. I'm the Executive Director of the Massachusetts Health Connector. In other words, we are the Affordable Care Act marketplace where people, individuals and small businesses can find health insurance options that are available to them, and they can get subsidies in many cases to help them pay for health insurance, which we think is really a great value to our citizens here. I'm really glad to be here along with my colleagues at PACE. They are one of the 10 organizations that will be serving as navigators in a community on behalf of the Health Connector, doing community outreach so that residents and in some cases small business as well can understand the options that are available to them so that they can seek the opportunity to get access to health insurance coverage. This is obviously not a new endeavor for Massachusetts. Massachusetts has been a national leader in health reform. We actually have 97% of the residents in health insurance coverage today, which is by far the highest in the nation. All of us are extremely proud of the achievement. Obviously, this is attributable to the collective effort by really the state as a whole. So even though this is my first opportunity to stand face to face with these colleagues, I know extremely well that they have been doing this type of work for many, many years, staying close to the community, telling them about the options available and encouraging people to seek insurance coverage so everyone can have regular access to health care. We are, however, extremely excited that the new health reform law, the Affordable Care Act, or the ACA, actually builds upon what Massachusetts has already achieved and advances health insurance coverage and the options that come with it to the next level. We are excited, for example, that under the ACA, more people will be able to access subsidies to help them afford health insurance. There are people who are currently beyond the income threshold that are eligible for subsidies, but under the ACA, they will have more help on the way. We certainly need a lot of support, sort of getting the word out there so the people who are currently not accessing these new opportunities, they are going to do so as the opportunities become available. At the same time, another reason that we really need support from the community, and particularly our navigator organizations, is the fact that we need actually people, residents who are currently covered through the Health Connector to go through an enrollment process so that they can continue their coverage come January 2014. So going from the Massachusetts reform to the Affordable Care Act, there actually is a transition process, and we do need many members who already have coverage to go through an affirmative enrollment process. And so this is part of the compliance. This is part of the operational transition that the state is responsible for completing. And what that means is we need a lot of engagement in the community so people actually know that this needs to be done so that they can do so in a timely fashion, and then come January, everyone is transitioned into the new coverage so we can avoid gaps in coverage and disruption to care. So that is extremely important. That is the most, sort of the highest priority that we're facing right now as the Health Connector, and we need all the help that we can get, getting the word out, getting people engaged. We want people who are trained and experienced and knowledgeable to be out there in the community, so when people seek in enrollment and subsidies, help is available so that they can actually get the assistance that they need to complete the process. So I am going to hand it over to my colleagues here at PACE, who will be one of these organizations in the community providing the help, and maybe you can talk about the specific work that we will be doing to facilitate that process.
Thank you, Jean. First of all, we at PACE are very proud to be one of the recipient agencies of Navigator Grant. Access to health care has been a priority for PACE for a long time. We've been doing this type of work on the ground level with folks who qualified for subsidized insurance for over a decade. And this new Affordable Care Act gives us a chance to interact with the community to let them know exactly what options are available and what they need to do to either keep or get health insurance, and provide them with, as the program says, a way to navigate through the healthcare laws. Unfortunately, the opposition to the Affordable Care Act over the years have spread misinformation around. You'll even see on TV some private companies offering to do this type of work for a fee. I would just caution people to make sure that they speak with navigators or other trained professionals that are trained by the Health Connector, so that they get the information that they need to be able to enroll in the proper type of insurance, select the best plan, and to know what's available to them. We currently have 5 staff that are going through intensive training on the new Affordable Care Act. And as Jean said, Massachusetts has been a pioneer in the country on universal health care and health care reform. So the changes in Massachusetts won't be as dramatic as they will be in some of the other states that don't have the track record that Massachusetts does. But it's still important for people to know what the Affordable Care Act is all about, know what options it gives them, and know who's eligible for subsidized insurance. For instance, people up to 400% of the federal poverty level, and in Massachusetts that's a family of 4, it's around $80,000, are going to be eligible for state subsidies and federal subsidies. There's a component in the Affordable Care Act for federal tax credits that either can be paid to the subscriber or directly to the insurance companies. So people out there who get their insurance through their employers probably won't see any major changes. People who are low income and already get Mass Health won't see any major changes. But the folks who buy their health insurance currently outside of their employment through the Health Connector will see changes and will see different options. The federal government has established minimum essential coverage that all health care providers must meet to offer health insurance. That meets that standard in Massachusetts. And in addition, for the first time, there'll be qualified dental plans. So even if you don't get dental insurance offered through your employer, you'll be able to go to the connector and to the marketplace and be able to purchase affordable dental insurance. So there are a lot of changes out there. I would say beware of people trying to sell you something that you're not aware of. To deal with people that have been trained by the connector, either navigators or certified enrollment counselors, so that you get the best information free of charge and help you navigate through the new healthcare laws.
There are quite a number of changes, but let me just focus on, in the context of this conversation, focus on what sort of touches members. I think that's the most important. I was speaking a little bit, and Bruce certainly sort of strengthened that point, is that there is expansion in subsidized coverage under the ACA relative to the Massachusetts reform. So for example, Massachusetts subsidized coverage currently covers people up to 300% of federal poverty level. Under the ACA, that threshold moves up to 400%. So that's new people, people who are newly eligible for subsidy. The second thing related to the expansion is that currently there are low-income, low-wage workers who are employed, and their employers offer insurance, but the insurance is expensive relative to their wage, so these people cannot really afford the employer-sponsored insurance, even with the employer contribution. But they're classified as people who have access to employer-sponsored insurance, so therefore they're not eligible for government-subsidized program under the current Massachusetts reform law. Now going into the ACA, this provision is removed. So we'll look at whether you have access to affordable coverage, whether it's other forms of subsidies or your employer-sponsored insurance, so long as based upon, the criteria area, it is not affordable to you, then our subsidies will be available to you. So that's the expansion of the subsidy front. I would say that, as Bruce mentioned, there is expansion in what is offered through the Health Connector. Not only do we have more health plans available on the product shelf relative to current, we're actually adding a major product line, which is dental insurance. Dental coverage compared with medical coverage, the coverage rate is much lower. In this state, there are about a quarter of people that do not have access to dental insurance at all, and most of them are individuals who buy insurance on their own, or employees and family members of very, very small businesses. Compared with the rest of the country, we're actually much better. For the rest of the country, is about half of the people, where a quarter of the people do not have insurance. So this is a little bit of a hidden healthcare problem, if you will, especially when you're looking at children who do not have regular access to dental care. This is problematic from the long-term health perspective. So having a place, a convenient place where people can have access to, be able to browse and compare and enroll in affordable dental plan is a huge improvement. And lastly, if I can just mention some of the infrastructure improvement brought by the Affordable Care Act. Currently, the Health Connector is, a consumer-friendly storefront, if you will, for people to have access to insurance. But going into the ACA, we're going to have dramatically improved member interface, particularly when it comes to eligibility determination for subsidy. Because currently, if you're a low-income resident, you're seeking subsidy, you actually go through a largely paper-based, pretty lengthy process before you are determined to be eligible for support. But come, the ACA effective date, that experience is going to be dramatically shortened. So those are just some of the things that we think touch members. And there are other benefits associated with the Affordable Care Act. For example, it strengthens state finances, and it introduces new changes to the insurance market that further streamlines the market. So there are other changes, but we think that from a member perspective, there are a number of improvements as well. Communications, education, and outreach in the community is one of the highest priorities we are pursuing as part of our broader ACA implementation effort. The Navigator program is a very important component of it. We have selected 10 organizations statewide to act as Navigator organizations. The overall funding is slightly over $1 million for the first year of ACA implementation, ACA marketplace operation. And so we selected organizations who have experience doing community outreach. They are able to do culturally, linguistically appropriate outreach activities. They already have the relationship in the community, and we also make sure that collectively they provide a reasonable coverage across the state. So for example, PACE really provides robust coverage for the New Bedford area. I just came from the Cape a little while ago, and that's the community action community of the Cape and the Islands, and then we have several other organizations across the state that are doing this work. What we expect them to do is number one, basically provide a sort of a site, if you will, that members will know. They can come to them, they can seek enrollment assistance. These people, like Bruce said, they are trained to not only explain the options, talk about the various sort of components of the change, but they also know how to use the system. So they can actually help members end to end, if you will. So besides that, we also expect them to proactively go to different places in their community on a regular basis to spread the word, sort of create these convening events, and then engage as many people as possible. So they are really the eyes and ears of the Health Connector in the community. We very much want this to be a grassroots-based approach, and we look forward to hearing actually lots of community feedback from them, what goes well, what doesn't go well, and et cetera.
Karen's my best friend.
I paid her $10 to say that.
I couldn't believe that my friend of 30-something years was a possible donor, that she was more excited than I was. And I'd say, Kier, you're not going on a cruise here. You're like giving me a kidney.
I can make my friend's life better. This was the right thing to do.
Thank you, Kier.